Hello.
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 How's it going?
We would like to introduce ourselves. So,
Yeah.
we want to first talk about some of our medical issues going on. Most recently, the hyperplasia, thymic hyperplasia. So I've been diagnosed recently with a thymic hyperplasia. The doctor, my primary care physician, thought that it might have been a thymoma, but we saw the cardiothoracic surgeon and he said that it's most likely not a thymoma, but a thymic hyperplasia. But given a lot of the symptoms that I was describing to him, like the extreme fatigue, the double vision, it gets worse at night, fatigue that gets worse as the day progresses, some other symptoms that I didn't even get to bring it to him, he already kind of cut me short and said you're a really good candidate to someone that might have myasthenia gravis as well. So we would like you to go see some of the neurosurgeons that work with me as a team, or they send me cases, or I send them cases about this possible myasthenia gravis. So this morning, as John was playing on a video game, I did a bit of research about. I've seen videos of doctors talking about myasthenia gravis, but I wanted to see testimonial for people that had the disease, and I found several videos that was kind of enlightening, because a lot of the symptoms that I have not been explained by other diseases that they told me I had. So in 2022, I was diagnosed with this is Gunther, head of complaints. In 2002, I was diagnosed with pituitary macroadenoma. And after that, they diagnosed me with hyperthyroidism. But after that I thought was just making me more sick, I found a new endocrinologist who actually diagnosed me with hyperthyroidism, Graves' disease. So they were giving me levothyroxine when in reality I should have not been taking levothyroxine at all. I actually had hyper, not hypo, thyroid disease. And we kind of been battling a lot of endocrine related symptoms, but some things were just not explained, just didn't make any sense, and we're just not getting better. And John can testify to this. Usually I work and I crash.
Yeah, she can basically hold it together for about 8 hours, and then she just needs to lie down and pass out. And one of the things that we kind of learned, they call myasthenia gravis sort of a snowflake disease, because every instance is different, so it's really kind of hard to pin down, and it usually masks as something else. Like, for example, for a while they diagnosed Fran with fibromyalgia. Fibromyalgia, which, and myasthenia gravis has all the same symptoms and sort of masks itself as that. So, they were giving her drugs for fibromyalgia, and, she wasn't really getting better, feeling better. And, and it's sort of a placebo effect in a way, because she wants it to work, so it sort of feels better, but the reality is it's actually the gravis. So, in some sense, we're lucky in that, we've diagnosed it pretty quickly. We've been watching online and seeing cases where people have diagnosed it, and they've been living with it for 8 years before realizing it. And, obviously they're progressively getting worse to the point where they would have to just rebuild their immune system before they could have surgery to remove the thymus, which is basically, what's going to happen. I would also like to point out that, after my morning of video gaming, I did clean the house and mow the lawn. It wasn't just all video games, just for the record. For the video record,
Yeah, and then another issue was, I think this got brought to light not because doctors were listening to my complaints, but because in August I had a pulmonary embolism.
Right.
It was actually 2 days after my birthday. I had a pulmonary embolism, and on the follow-up, 3 months follow-up from the embolism, they went to do another CT of my chest, and then when the radiologist, I don't know if it's the radiologist, the name of the doctor, the person that noticed the mass, and basically said, you need to take care of this, you need to see someone about this, you need to see a cardiothoracic surgeon.
Right. So we've seen the surgeon, and the surgeon...
We've seen the surgeon.
The good news is it's, he found a scan from about 4 years ago, which wasn't a full scan, but it really looks like it hasn't grown that much or at all.
Yeah.
So,
yeah.
It's not we have to get this out right now because it's going to
Actually, he said that it has grown some,
but not that much.
But not that much.
But, where it's located, it can put pressure on the heart and other, vital organs. So once it starts growing, you really kind of have to get out. And he said, we're not at the point where it's an emergency surgery. But it is surgery. And, we'll stop the symptom or stop some of the, symptoms. It'll, hopefully reduce the effect of the myasthenia gravis, which, again, the next step is to talk to the neurologist, which, of course, we live in the United States, so that means the neurologist all told us, I think the earliest they could see us was September.
When I was calling.
February 2nd today, so that makes it, obviously we don't really wait 7 months. Now, our thoracic surgeon did say that he had some friends that were, neurologists, in his private group, because obviously this is a related field. They work together a lot dealing with this, so he's going to put in some calls, hopefully get us to see someone sooner, and then it's probably going to be surgery. But again, the good news is we caught it relatively early, it seems like, in this progression, and so we can maybe hopefully cut it out, maybe a bad choice of words, but get it out quickly and
it's just
get your life back.
It's just, I want to say that for the longest time I've been struggling with symptoms such as extreme fatigue, pain in my jaw, trouble swallowing, getting I make fun of him how he takes pills, because he can just take a pill and the pill goes down, and I drink with a bunch of water, and sometimes the pills get stuck in my throat, and I'm like, I could never just take a pill like that, it wouldn't work. And then I was reading some testimonials today, and a lot of people have problem with this area where they have jaw pain, or they get food stuck on their throat, or pills stuck their throat. So another symptom is pain in my face, in my jaw, or this gets tired,
And for all these years, he's been accusing me of being a serial killer because I can swallow my pills without water.
Exactly.
All this time, maybe I'm just a normal person. Maybe I'm a killer.
That's still serial killer behavior. Taking your pills without water, it doesn't sound right in my mind.
Seems like I must be a damn good one, because I'm with you all the time and you have and you never caught me. So
and then
I'm like Dexter times 4.
And then another symptom that body temperature regulation. We live in Texas and extremely hot in the summer, and it kills me. I can't go out.
Well, really, this past summer is when
this past summer was extremely bad. Fainting, dizziness, a lot of dizziness.
Another big symptom of myasthenia gravis. So hopefully,
fainting, dizziness, a lot of just not feeling well in my head either. Brain fogginess. Usually, I'm a very studious person. I like to learn and study and just learning new things in general. As a hobby, and I haven't been able to do nearly as my usual, can't read a book and absorb the information that is in there, I've been trying to learn a little bit of, this data science thing, and it's been such a struggle because I feel like my brain is just in a fog, so there's a lot of symptoms, like breathing issues, pain in my chest. We have been going to the ER just in the past 3-4 months.
It's been a couple of times we've gone with chest pains,
with
which,
chest pains.
we're at the age, you get chest pains, you go to the ER, and for everyone out there, if you're feeling chest pains, go to the ER.
That's one of the reasons, like...
As my brother likes to say, if you're asking the question, should I go to the ER, the answer is probably yes, and you should just go.
Yeah.
But, obviously we went and, sent home a couple of times, oh, you must have pulled a muscle or something.
Pulled a muscle, but it was like intense chest pain.
That's a symptom of this whole thing is chest pains and all that. So a lot of it kind of makes sense. And, again, hopefully we can get to see a neurosurgeon soon or a neurologist soon and, get confirmation at the very least. And either start some medication and, get prepared for surgery, I guess.
Get prepared for surgery for next steps. It seems like that's where we're heading.
Obviously, nobody's happy about surgery. It's major surgery, but it is,
So they told us a little bit about the surgery. So they said 3 to 4 days in a hospital, depends on how well you respond. Surgery lasts between 3 to 4 hours. Minimal 10 days recovery at home.
Feeling like crap for about 2 weeks.
Feeling like crap, like for 2 weeks,
which
basically.
Probably means 4, because that's just
most likely. So if they're saying 2, that means probably 4.
Maybe for 20-year-olds it's 2, but for older people
is more like 3, 4. So
6. Don't sleep on it wrong, because then it's like 12.
So just trying to figure it out, like how this journey is gonna play out, because for the longest time when I was going to doctors, there was a lot of dismissal, like this is coming from your head. Have you taken I have some psychiatrist problems, I have bipolar, I have schizophrenia, and they're like, have you taken your psych meds? It was like, this has nothing to do with my psych medication that's well controlled and is not the issue. I know when it's anxiety, this is not anxiety. So
a big problem with
and
listening to the patient in this country.
So I knew something was wrong from the very beginning. I just didn't know what it was wrong and what was the name of it and how to treat it. So for us, maybe finding this new neurologist, which we just put referrals this week. We put referrals out there, so...
And our sister-in-law gave us the name of her neurologist, and so we haven't tried yet, so we're going to see if they're taking your
We send them a message via the portal to see if someone calls us back to schedule an appointment.
If not, call on Monday and try and see if we can see someone in the next month and progress this along, and get you to the point where you're going to have energy again.
Feel at least decent, because this is not living, this is barely surviving. This is barely surviving. So I can't participate in society like a person that has full energy. I can work and sleep, and I've been sleeping 10, 12 hours, and I still wake up trashed. It's really hard. And, I saw someone saying on a video, like, imagine if you're doing, bicep curls, and if you keep doing that, it's gonna get a time that your arm's gonna get tired. Is that tiresome that you feel, but all the time? Like you put maximum effort just to do the bare minimum because your body can take it.
Wow.
So.
Well, speaking of that, it's Sunday afternoon. We're gonna go lay down and binge watch some cheesy Netflix. So
we're gonna try to just watch some.
But we just wanted to give you an update, and we'll see you soon.
Bye.
Bye.